Bonjour à tous. Good morning, everyone. Prior to starting with the presentation, let me thank the organizers for this opportunity which has been given to us to share with all of you our experiences with MMS in Haiti. It's also an honor for me to be part of this virtual symposium micronutrients, the fifth global conference on micronutrients, which gathers people throughout the world despite of COVID-19 pandemic. Anemia is one of the biggest nutrition public health problems in Haiti. According to the national data, during the opportunity window, which is the most critical nutrition period in a child's life, 50% of pregnant women, 30% of lactating women, and 75% of children less than 23 months out of 61% of children less than 5 years suffer from anemia. In accordance with WHO recommendations for a positive pregnancy experience, the Ministry of Health has taken steps to introduce MMS in its national protocol and expand the program nationally in partnership with Vitamin Angels. To do so, we are conducting implementation research in order to inform the program scale-up. I invite Dr. Dacius, who is the Vitamin Angel Director in Haiti, to talk about the implementation research.
In fact, in partnership, the Haitian Ministry of Public Health and Population, Vitamin Angels, Johns Hopkins Bloomberg School of Public Health, and a local NGO, the Haitian Health Foundation, we are conducting an implementation research to inform the scale-up of an MMS program in Haiti. One key component of this research is to develop and field test SBCC strategies and tools intended to support the uptake and adherence of MMS among pregnant women. The implementation research is actually described in the Silent Life Special Report on MMS. In terms of site selection, we chose 5 communes within the Grandas department. We selected that site because it has the second highest rate of anemia and has an existing antenatal care platform. We went through a very systematic process review. We sought guidance from Silent Life and utilized their 8-step process for developing, implementing, and evaluating new behavior change strategies and tools. To start with the process, we worked with key stakeholders in Haiti to develop the program goals and objectives. We convened a workshop with key government stakeholders to explore maternal nutrition, antenatal care, and implementation of an MMS program for pregnant women in Haiti. We set the objective of providing MMS to all pregnant women in Haiti, as well as to increase uptake and adherence to MMS. For the step 2 of the process, we use the socio-ecological model that provides the guidance for the basis of the formative research study design and the framing of the overall demonstration project. It provides a framework for understanding the multiple levels of influence on women's behaviors during pregnancy, including personal, interpersonal, community, health system, and policy. The step 3 of the process consists of a formative research. We conducted in-depth interviews and focus groups with women, influential family members, community leaders, and healthcare professionals. The objectives were to understand experiences and perceptions related to pregnancy, antenatal care, and prenatal supplementation, and to understand the barriers and enablers of ANC and prenatal supplement use and adherence. A 2-week acceptability trial was also conducted with pregnant women to examine the extent to which MMS was deemed suitable, satisfying, or attractive to them. As for the formative research findings, there were barriers and inhibitors to antenatal care and supplement use, considering the multiple levels of the socio-ecological model. Some key themes we found were related to the side effects of the supplements, fear of large baby and C-section, community beliefs, ANC access and quality, supplement access and quality, poverty. These are some of the quotes that represent the themes that I highlighted related to the barriers. For example, that pregnant woman in the commune of Jeremy who said, my friends warned me about the negative effect of the multivitamins on the baby's weight, which could lead to C-section. They told me to take little from the package. If they gave me 30 pills, I should take 10. Regarding the inhibitors now, the themes were mainly related to family support, community awareness, trust in the health system, community channels, fear of anemia, ANC access and quality, supplement use, and quality. Here are some examples of quotes that highlighted those themes. For example, the pregnant woman in Bonbon who said, she, referring to a pregnant woman, should take it, referring to the MMS, for anemia, so that her blood can speed up, to have more appetite, to have more strength to deliver a good baby. We also found several opportunities and challenges as regards to the healthcare system. They're about the role of the providers, the community, their responsibilities, their motivation. We found some key points in the relationship between the health providers and their communities. We're also informed on the functioning of the healthcare system, its dynamics, and its structure. Let's take, for instance, in regard to the opportunities at the healthcare system level, that quote from a husband in Marhone who said, if you follow the advice from the healthcare providers, everything will go right. As we have completed these steps, it's become clear how important it is that the process be an iterative one, always allowing the insights gained from one step to inform the next. We started with a stakeholders workshop back in September 2018. We've completed 3 steps so far, as shown here. Now we're working with a local design agency to develop and field test SBCC strategies and tools and to strengthen the ANC system. We're also working with the Department of EPI from the Ministry of Health to conduct baseline survey before we implement the intervention and an inline survey right after the intervention. Now I turn it over again to Dr. Marhone, who will sum up with the current efforts of the Haitian government in these times of COVID-19.
Thank you, Dr. Mino. But you have to know, as we were going through the implementation research, COVID-19 pandemic it becomes harder for pregnant women to meet their nutritional needs. WHO and UNICEF then came out with new guidelines to implement nutrition activities in the context of COVID-19. The Ministry of Public Health and Population has decided to start expanding the program. Together with Vitamin Angels, we put in place a mechanism to distribute MMS and provide all necessary resources to the regional departments to operate an adequate supply chain management and effectively reduce pregnant women. So far, we have reached 6 out of 10 departments, and the zone as we are progressing with the implementation research, which will further consolidate the scale up of the program. Now, this is the time for us to acknowledge the Minister of Health and Population, the Haitian Health Foundation, John Hopkins Bruberg School of Public Health staff, Vitamin Angels, Sight and Life Foundation, Kirk Humanitarian Foundation, research participant. To all of them, we say thank you, merci beaucoup.